Good afternoon, everybody. I would just like to welcome everyone to Theraplay and Growing Bones, Pediatric and Neuromuscular Orthopedic Institute's presentation and conversation today on what is cerebral palsy. I'm going to take a moment to introduce everyone who is going to be on the panel, and then I'm going to go ahead and turn my camera off and mute and let our experts take over. At first, I'd like to introduce Dr. Justin Connor, who is a board-certified pediatric orthopedic surgeon and is one of the founders of the Growing Bone Pediatric Neuromuscular Orthopedic Institute. I'd also like to introduce Courtney Ford, who is the office manager and practice manager at Growing Bones. I'd like to introduce Sam Deasy. She is a speech pathologist in Newark and the center manager. I'd like to introduce Neely Thompson, who is our physical therapist in Newark, and I'd like to introduce Carly Alexander, who is our occupational therapist here in Middletown. I'm going to go ahead and give Dr. Connor the floor to go ahead and begin the presentation, and thank you for everyone joining.
Thanks, Carrie. I really appreciate it, and just thank you for this opportunity. I always just am privileged and honored to speak at these and to be able to speak to just communities that mean a lot to me. I sort of went into medicine really with the idea that I wanted to create an ongoing impact in our community, just in different ways. And as I was going through medicine, the cerebral palsy and the neuromuscular community is one that in particular just grabbed me. There's these missions in your heart that just grab you when you weren't really looking for them, and specifically the families and the patients and what they are able to do and achieve, and their stories are just so fantastic. So just a little bit about me. I'm an orthopedic surgeon, as she said, work specifically with kids, but then also with kids who grow into adults with some of these chronic conditions. I've been working with the neuromuscular community for over 10 years. I was blessed enough to be trained at DuPont Children's Hospital in Wilmington, Delaware, who has a strong neuromuscular and cerebral palsy program, and actually worked in that program a number of years. Was integrated into their gait lab and was one of their interpreting physicians for their gait lab, as well as worked with that team that's there. I was a board member of the United Cerebral Palsy of Delaware for 8 years, and I'm active in other organizations as well that's related. I think when I have these conversations, I like to talk as if I'm talking just directly to a patient or a patient's parent, right? And so, because to me, that's the way that I like to people to talk to me. Without going into too much detail, before even just talking about cerebral palsy and what it is, it's the whole lead up to it. And I think that's what, as medical professionals, a lot of times we fail to remember. That there are lots of emotions and there's lots of anxiety and there's lots of uncertainty with this diagnosis, right? And so there's lots of medical terms that are thrown around. There's lots of specialists that are being seen, and really, parents don't always get the straight answers that they're looking for. They don't necessarily understand what's coming at them because no one necessarily being straight. And so for me, I remember that there's fear and anger and anxiety and all these things that are swelling around this diagnosis, which may or may not have some other types of social stereotypes associated with it. But really, the emotion that I like to really focus on is that of hope. And that's really what I have my parents focus on, really just like any other child, right? So for my 4-year-old, I have the same ambitions and anticipations for her as I do for my 4-year-old, patient who doesn't have, who does have some of these limitations, right? And so, but really what they're going to do, what they're going to achieve, how they're going to make the parents proud, the things that are going to surprise you that they never knew, that you never knew that they could do, and they never knew they could do. All those things that a typical child goes through in their typical development are really the things that are why I do what I do, right? And so, just to define what cerebral palsy is, just just as a medical definition, it really is. It's a condition that it affects the physical body, so it affects a person's ability to move, and it's associated with a static event or an injury to the immature brain. That can happen before birth, during birth, or after birth, up to 2 or 3 years of age, that leads to sort of a permanent condition. Now, that being said, there are different levels of how severe it can be involved, whether it's severe or whether it's mild involvement. And so while there's some associated things that come along with it, it does not define, other aspects of the child, like their intelligence or their personality or things like that. While there are some associations with walking and mobility, it doesn't mean that they have to be in a wheelchair. It doesn't mean that they're going to be relegated to a bed for the rest of their life. Doesn't mean that they're not going to interact with their environment. And so I think that's also important to know. And it comes with certain characteristics. There's delayed milestones. That's often one of the first keys, and which is why a pediatrician is integrally involved, and why our therapists are all involved very integrally, because of some of these milestones and stiffness that can be associated with muscles, right? And so, and as very general, we characterize it as different types of cerebral palsy, and it can be based on either the distribution or the tone of the muscles, right? And so distribution meaning what's affected. And so when it affects your legs, we call it diplegic. And when it affects one side of your body, we call it hemiplegic. And when it affects all 4 limbs of your body, we call it quadriplegic. It's just sort of a description of what's involved. And then, how is it involved? Is it tight? Meaning that's what we call spastic. Or is it loose? That's what we call, hypotonic. Or is it uncoordinated and dysregular, which is called dystonic or athertonic. And so there are these different terms, but we sort of put them together just so that we know what we're talking about as a medical community. But then as as a parent, you're able to describe and just sort of also know, different things that are done in these different categories. And so for me, I think when we're talking about what to expect, and I think, I'll hand it over in a minute, but really what to expect is, I think for the whole medical community, it's about setting goals. And it's about setting these goals with parents, with patients, with providers, so that we all want to reach these different goals. And we all have different ways of getting our patients there. And I think that this is one of those communities where there's a medical community that's integral, and there's a social community, right? So, no one doctor, no one specialty is really going to get, is going to be able to achieve everything. It really is a community, but it's also a social community to get patients, where they want to go as well. And there's all kinds of stories about that. And so as an orthopedic surgeon, my goal is to basically optimize the muscles and the bones and put them in good alignment, right? And so to basically make it as easy as possible for a patient's body to move the way that they want it to move. And then I work with other specialties that strengthen them and that help them to coordinate and help them to balance and help them to do other things. And I'm not going to go into that realm, but there's other specialties that help us do that. And the neurologist will also help in the diagnosis and some of the other things that may be associated, and then all the other supporting medical staff for individual child's needs. And so everything really is individualized because every patient is different. And we first treat the needs of the patient and then we try to optimize those things. And so I think that there's a lot more I could say, but I think I'll hand it over to one of my my co-panelists as well, since they're also equally integral into sort of this management as well.
Neely, would you like to get started?
Yes. Okay. That was some really good information. I am just going to be talking a little bit about the role of physical therapy for kids who have CP. And like Dr. Connor mentioned, there are a lot of different ways CP can present, whether it's, both of the legs that are affected, half the body. And so we really tailor our goals and our treatment to that. But overall, our goal is to just help kids gain strength and mobility to function at their best and the highest level that they can. So just to go over a few of the areas that we work on, the first is what we call range of motion. That is kind of the flexibility of the muscle. So with CP, kids can present with higher tone in their muscles that can make them appear tight and stiff, and it can be a little bit harder to move. And so something that we really prioritize is stretching the muscles. So we are often stretching the legs during sessions. And then we also create home programs for families so that the parents are carrying over that stretching at home as well. Another area we work on is strength. And so even if those kids have higher tone in their muscles, they can be pretty weak as well. So we, do age-appropriate strengthening. It's all play-based, child-based, to help then with those higher level skills like walking and standing. Another area we work on is posture. And so posture can kind of go hand in hand with the weakness and the tone. And so we're working on posture as kids sit. Sometimes we use some sort of adaptive equipment like a wedge or something underneath them to give them a nice stable base so that they can then go on and do things with their hands or participate in school, eat meals with their families at the dinner table. We also work on their posture standing up, which can kind of then carry over into walking. And so again, with the weakness and the tightness, walking mechanics can be affected. So we're looking to kind of optimize the way in which kids are walking. Sometimes that could be us working on the balance to increase how far each step is, increasing speed. It could also involve working with some sort of assistive device, whether that's like an orthotic or a full assistive device, kind of like Dr. Connor mentioned, potentially wheelchair, rolling walker, something along those lines. And so that kind of brings me into the final area, which would be that specialized equipment or mobility aids. And so we often see kids who do have some sort of orthotic. That could be, a brace that goes from the ankle, it could extend up towards the knee, beyond the knee. And our role as a PT is we're helping the child use it to the best of their ability, looking for it to improve the way they are walking, give them that stability so they can go that much further as they walk. Some orthotics we're actually able to fit the children for in the office. And then if they would benefit from one that we aren't able to, fit them for ourselves, we can always refer them to the correct people. And then the last area would just be assistive devices. So something like a rolling walker or wheelchair, if appropriate for the child. We could help families start that referral process. We can also help the kids and the families learn how to utilize it to the best of their ability. So that kind of brings me to the end of PT's role, but again, just overall looking for kids to be as safe and independent with mobility as possible.
Awesome. Carly, are you ready?
Hi, yes.
Hi.
Hi, my name is Carly Alexander. I'm an occupational therapist. So kind of to piggyback off of what Dr. Connor was saying, so the way in which CP can kind of affect our daily participation in occupations is sometimes the muscles can present stiff, which can affect our movements. So they could be jerky, and it can make engaging in different activities or with different types of equipment. So something as simple as like brushing our teeth or engaging in like self-eating or different activities of daily living. So sometimes the muscle tone can be, high or low, which means that the way we engage with different objects is going to be difficult or different for each kid. And then sometimes we can have difficulties with balance or coordination, which can make, a kid might appear to have shakiness or tremors. So all of those things can make engaging in various activities of play or activities of daily living, as us OTs call it, ADLs. So those can be affected when we're looking at development. And just as a little insert, we call ourselves occupational therapists. So occupations are anything that we need or want to be participating in. It's not necessarily jobs, skills, or things like that. So that can go from academic tasks to play, to sports, to art, to, getting ourselves ready, activities of daily living, self-feeding, dressing, bathing, and even social activities or in engagements. So the other thing that we can help work on are some cognition activities. So we can work on play skills or academic activities. We can also help with social engagement and how that looks. Specifically, what OTs can do, we can address physical deficits with splints. So kind of what Neely was talking about, but we would focus mainly on the upper extremities. And that's mainly because when we're thinking about occupations and engaging with our environment, that mainly comes from the hands. So we can work on, getting our hand function to improve so that way we can hold a toothbrush better or hold a paintbrush better, depending on what the kids' goals are or what they're motivated by. So we can work on splinting also to prevent further damage to joints or any stiffness to the muscles if we want to keep the hand in different positions for different periods of time, just to help keep that functional and to facilitate functional movement patterns within the upper extremities. We can also work on postural control or strengthening or positioning, but mainly for the engagement in occupation. So if we need a kid to sit in a certain position or in a certain piece of equipment in order to participate in self-feeding at the dinner table, that is something that we can look into and either coming up with compensatory strategies, or if PT's on board, they could be working on strengthening so that they can support during those activities. We can also work on repetitive task activities to improve coordination with the upper limbs for reaching, and also repetitive activities with the hands to improve coordination and kind of motor planning. And then we can also work on strengthening. So we can work on strengthening muscles around the joints to help better support those joints when they're trying to grasp or when they're trying to reach for different objects. Then we can also facilitate engagement with reflexes. So sometimes these kids have really great reflexes. So one thing that we might do is like tenodesis. So if they go like this, they might have a better grasp pattern. So we can work on a splint or something that might help them hold something or train them to be able to hold things in this grasp pattern, because ultimately we focus on function. So it might not be the way everybody holds a spoon or a toothbrush, but if they can hold it like this, we want to get them engaging and as independent as possible. We might also work with adaptive equipment like a universal cuff or different things to help them hold or reach better and more functionally. And then, after surgeries or orthopedic activities, we might help them with range of motion or strengthening or pain management in the upper extremities or hands. And then we could also help with functional transfers. So working on getting to a bathroom chair or working on getting to a commode or a toilet seat or anything like that, embedded into the function of occupations. So bathing or toileting or things like that. We can also work on home exercise or activity programs with parents to keep them managing the skills that they gain throughout therapy. And lastly, we can work on task modification. So sometimes it might be something as simple as, instead of painting or coloring on a tabletop, maybe we need an easel to put that arm in a better functional position so they can access it easier. So those are just some of the things that we can do. And then obviously we can do co-treats and we can support speech therapists with positioning or use of devices or functional communication. And then also we work really well with our PTs as well, because they can help us work on positioning and stability while we then work on more refined fine motor skills.
Sam, are you all set?
I am, yeah. So I'm Sam. I am a speech pathologist. So just to go over some of the things that speech therapy can do in working with these children, we can work with articulation or speech sound production skills. So sometimes children have difficulties with moving their muscles correctly due to muscle weakness or oral motor control. So we work on the production of specific speech sounds, working with them to know where to place the different parts of their mouth to produce clear speech. In general, we work on all forms of communication skills. And again, kind of like Dr. Connor was saying, our overall goal is just functional communication. So any way that they're able to communicate their wants and needs and socially interact in their environment, whether it's through verbal speech or through the use of an AAC device or through the use of a communication board, our overall goal is for just functional communication. We do also work on feeding and swallowing difficulties as well. So again, might be caused by difficulty chewing, swallowing, digesting, again, from oral motor control or from weakness of any type. So we work with that, as well as diet modifications or any type of different consistencies that they would need to eat based on their skills. We can also work with fluency and voice, so any type of repetitions or interruptions in speech, and also vocal pitch, volume. That's something that OT and PT can definitely help us with when we're working on, is having them in the correct position so that they get enough breath support to be able to provide loud and clear speech. Another thing that we can work on is language development, so both receptive and expressive language skills. Might be processing language and understanding language. It might also be putting their ideas together to form stories and narratives to talk about things that they've experienced or that they've read about, things like that. And then we can work on some cognitive skills as well, such as executive functioning, memory, and other things like OT was saying that they might need for those daily functions to be able to participate in. So when working on swallowing, our goal is to increase oral motor control, improve muscle strength. We can do different techniques such as massage or stimulation to the oral muscles to work on those skills. Same thing with oral motor issues. We can work on strengthening, imitating oral motor movements, placement of different parts of our mouth that we need to produce clear speech. And then when working on language, we typically would use toys or books or any other, like they were saying, play-based therapy to develop those language skills. And some of the tools that we can use in speech therapy, we have a bunch of different tools, especially for feeding therapy and articulation therapy. So we have some chewy tubes that they can practice chewing on prior to learning to chew with actual food. We have what we call a Z-Vibe, which is like a vibrating toothbrush that has different tips that we can put on the end to increase oral motor awareness of the different parts of their mouth. We also, as I was saying before, do use AAC devices. That's alternative and augmentative communication. So whether it be an app on a tablet or an iPad, or a picture book where they have the pictures that they can use to communicate, or a picture board, we use those as well. And like Neely was saying, we collaborate with those companies that provide the devices, and we're able to trial different devices and see which one is best for the child right here in our clinic. I think that's all for speech.
Amazing, Sam. Thank you so much. Thank you, Carly. Thank you, Neely. I'm going to go ahead and pass it one more time to Dr. Connor so that he can kind of summarize and wrap things up for all of us. And then Jason, if you could let us know if we have any questions, that'd be great.
Thank you. And, I think that, what you sort of just been able to hear is, this is really the core part of the team. And so, the therapists that are working with the kids, it really is important, I think, to not to underestimate the value of a good therapy team. And especially one that is specific toward your pediatric population. While physical therapy and occupational therapy and speech therapy are taught, being able to work with, number one, kids, and then secondly, kids who have special needs, it really is a gift. And so it's, I know I, as an orthopedic surgeon, rely very heavily on their services. While the surgeon or the pediatrician, we're often at the sort of, we're sort of the visible part of the team that the parent sees. They work with a therapist day in, day out, year in, year out, And, you know, for what I do, I often will work with them, you know, at intervals, at 3 to 6 month intervals. And as their problems are associating are coming about, you know, we'll talk about, well, what non-operative things that we can do. And then, you know, we'll work on bracing, and we'll work with therapies, and we'll work with occupational therapy and splinting and those types of things. And then as we start to get to things that are surgical, that require some type of intervention, well, once again, I'm talking to the therapist as well and saying, okay, so, you know, what can we reasonably expect? And this is what we're going to do, and this is going to be the rehabilitation following. And at least for me, and I didn't mention this before, but so surgery is what I do, but it's what I do to get to a greater goal to facilitate. And I look at surgery in 3 different ways. Number one, spasticity and managing tightness of muscles and how muscles are working. And that's, you can do that medical, you can do that surgical through baclofen and pumps and things like that. Muscle tightness and muscle tone. So stretching is very effective, but sometimes you need surgical intervention to make those muscles longer so that they can physically do these things. And once again, they have to get rehab and get strengthened once again. And that's either in the upper extremities or in the lower extremities, and doing various things like that, or bone surgeries where bones just, you know, if things are not where they're supposed to be and it's a bone issue, well, then yes, we put them back into alignment. But once again, it's placing them in that optimal position for them to do well and excel. And I do also want to just leave everyone with resources, because I think we're all blessed to be able to work with these kids and to see what they do over time. And as a parent, it's very scary when you're very in that moment. But then, you know, to have seen a child who is 5 years ahead, 10 years ahead, I think is very, very useful. So talking to other parents, talking to a social community, talking to a Facebook community is very helpful, because, like I said, there are lots of emotions that come along with this. At least in Delaware, but then even on a national level, United Cerebral Palsy of Delaware is a fantastic resource. There's one in every state, so there's in Pennsylvania and Maryland. We happen to be here in Dover, Delaware, but, you know, and at least UCP of Delaware, they're very active. They have many activities. They have respite care for parents who need to take a break for a little bit. They have cookouts. They have a summer camp. They have all kinds of different things where kids can also see other kids who may have a similar condition and be able to interact with them on a kid-to-kid level, right? And so another resource that I'd recommend is, it's a book that I personally like for parents specifically. It's less for medical professionals, but more for parents, called Cerebral Palsy: A Complete Guide to Caregiving. It's like copyrighted 2006 by it's written by Dr. Freeman Miller and Steve Bacharach. But basically, it's sort of all those questions that families have that this orthopedic surgeon and this pediatrician have sort of compiled. They compiled all these different questions and all the different things associated with it, and try to make it very simple and straightforward to sort of understand. And then, you know, finally, having hopes and dreams for the kids. I love it when I see kids go to prom. I love it when I see kids doing their first dance, walking across the stage, you know, surprising their parents. And, you know, that's why I do what I do. And I think that's why a lot of us do what we do for these moments. And so, you know, that's probably what I, you know, want to just wrap up with, because that's what's important. The medical side, you'll talk to us, and you will find out the different information that is relevant to your child and to what's important to their specific need. But if you have a good therapist with good training, who works well with them, who interacts well with them, and a doctor team who works well with them, and you understand them and they understand you, that's really what makes for great outcomes. And that's really what makes for just a wonderful, you know, patient experience.
Dr. Connor, I don't think that could have been put any better. I think we can all agree on that. Jason, do we have any questions?
While we don't have any audience questions at the moment, I know that once this video posts to our Facebook, we're going to get quite a few comments in the comment section. So go ahead and leave those questions in the comment section. We're more than happy to answer them after the fact.
Awesome. All right. Well, thank you again, everybody. Thank you so much for your time this afternoon. And we're looking forward to all of your comments and any questions further so that our panel of experts can get things answered for you. Thanks and have a great rest of your Monday.